Okay, hi, my name is Erin. I'm your Inspiring Insights host for this evening, and every Wednesday at 6 p.m. we do this show, which features amazing practitioners, mostly in the Greater Toronto Area and Ontario, but we're venturing outside of Ontario and even outside of Canada as we speak. So we really started this program as a vodcast at first, and now it's a full show with several episodes, and we are at episode 12 now, talking about everything that has to do with women's health. And I say that lightly because I understand that women, have specific needs, and also there are a lot of non-binary folks out there that may or may not go by identify as women or as females. And so we kind of started with our new company called Reawaken Co., a health education platform that focuses on the health and wellness of individuals that are self-identified women and also non-binary folks. So our hope for you folks here today is to really connect you with the practitioners in the alternative wellness field that can help people thrive. And we want to inspire folks. So that's why we're here. That's why we're doing it. So today I'm going to introduce Courtney Russell. I almost called you Courtney Clayson just then because I know her as Clayson. But Courtney recently got married. So Courtney Russell, she's a naturopathic resident at Two Rivers Health in Guelph here in Ontario. And she's also a recent graduate of the Canadian College of Naturopathic Medicine, where we both met. She has a passion in fertility, pregnancy, and postpartum health. She also loves sports medicine and helping anyone with their health goals on that in that realm. Courtney's also a mama to a sweet 2.5-year-old and a new puppy. So it's safe to say that Courtney, you're learning how to balance motherhood, your own private practice, and then your own 2 new businesses, which one is Well Baked Box, which is going really well right now. Everyone tuning in should check it out. And also Fecunditas Fertility, which is we can talk about that more in a bit. Yeah. So in your spare time, Courtney, you love spending time outdoors, playing ultimate frisbee, and keeping active. And I really had such a good time going to school with Courtney and getting to know her better and seeing her pregnancy throughout the whole thing. And I thought, why not go into full-on detail with Courtney here tonight on preparing for pregnancy, kind of 101, and how naturopathic can really help in that regard. So I'm looking forward to it, Courtney. Welcome.
Yeah, thanks for having me, Erin.
So I guess we can start, Courtney, with maybe just a little bit more about yourself. What got you interested in naturopathic medicine?
So I went to Wilfrid Laurier in Waterloo, and I did both my undergraduate there in biology as well as my master's. So I did a master's in botanical medicine, but not really related to the naturopathic field. I did parasitic plants. I studied them. And then I learned more about how parasitic plants can be used naturally to help different things. So that kind of opened my eyes to herbal medicine and how it can be used for lots of different things. And I became more and more interested in it. And then when I was in my last year of my master's, I decided to come off the birth control pill and my period just vanished. And then went to the doctor being like, okay, it's been like 4 months. Where's my period? And she was like, oh, it'll come when it comes. And I didn't like that answer. So as a researcher, I kind of looked at all my options and lots of different herbs to help bring back your period and to balance those hormones. So I looked for a naturopathic doctor in Waterloo, and she was great. Dr. Kim Bretz was her name, actually. I remember her because it opened my eyes to naturopathic medicine. And again, I went on a herbal tincture, and within 3 weeks, my period was back and regular. And I was kind of like, wow, this is amazing. And I didn't know what I wanted to do after my master's, but I love working with people and helping people. And so then I took a tour of CCNM, which is where Erin and I met, and decided to go. And that's where I kind of let off there.
Yeah, that's incredible. Thank you for sharing your even just a little tidbit about the hormone journey, because that is so common. That story. Unfortunately, I've just what you said about your period, like just not showing up, and how what you've been dealt with, or as the healthcare system kind of just like cares or doesn't for you. That is so. It's happened to a lot of people. So I appreciate that, in the sense that, yeah, like there is so much more that we can do, and preventative medicine, unless you're somehow trained or even interested in like plants like yourself or naturopathic medicine, there's so much out there on the internet that we can look up and that kind of thing. But, then it comes down to what's being safe and what's not. And
right.
There's so much out there, right? So
yeah.
I think that, just sharing what you did is really good for folks to hear, and that you went to see a naturopathic doctor, and that made all the difference. And that made all the difference for your own career too, right? Which is
definitely
so big. Oh, I love that. So, Courtney, what kind of, I guess in your own practice now, like what are the top 3 things that you help folks with?
Yeah, so right now I see a lot of fertility, whether that's individuals who are looking to prepare for pregnancy, so preconception, so optimizing their chances to conceive naturally and healthy. I see a lot of fertility where, patients are coming in and they've been trying for anywhere from 6 months to 2 years, and they're just looking for some support and guidance that way. And then I see a lot of pregnancy and postpartum, so supporting them throughout the trimesters.
Yeah, so the full gamut of preconception all the way to post-conception, which is amazing. And
yes,
so much of that comes out of having your own experience with that. So I appreciate that. And I worked as a birth doula in a past life of mine. And I felt that because I didn't have any sort of anything to go off of, because I myself hadn't had a child yet, so there was that kind of sense of like, I don't want to call it like less confidence, but maybe that's what it is. And when you go through it yourself, right, it's so different.
Yeah, you can just relate to people a little bit more, like with anything, right? So when someone's pregnant, you're like, yeah, I went through that. Like, I remember those stages, and I remember feeling that anxiety or these symptoms. It's definitely, especially birth.
For really. Sure. And I mean, just to touch on that, like the media really just tears, it just tears. I don't want to make a pun here, but basically the media really portrays birth as something that's like super medical, and also something that's super painful, which doesn't always have to be the case, right? And isn't always the case for a lot of folks. Maybe we'll just talk about that for a second if you want, because there's so much within the birthing world. And I know that you have talked about this a little bit on how like negative stories, for your own pregnancy really made an impact.
Yeah, I definitely. I find like what you said, the media kind of portrays birth as scary, medicalized, painful. You should get an epidural. You should go to the hospital. And I don't necessarily think that always has to be the case. And I was lucky enough to come across this book, or I was given this book during my pregnancy, and it was Ina May, A Spiritual Guide to Childbirth. And it was just this amazing book. It had like a lot of informative chapters, and then the other half of the book was just birth stories that were very positive and talking about the different things you can do with them. And I had a great birth, and I like to talk about that with patients, like ask them their fears, if there's any, or what their thoughts are, and kind of inform them on their options, and that birth doesn't have to be scary. It can be an experience that is amazing. Like, think of how amazing it is. You're birthing a human into the world. So we cover a lot of that. I would say with pregnancy, just talking about the birth, that story that they want and that they hope for. Yeah.
Ooh, I like that. Yeah, and removing that fear out of it. Well, it's like I think fear is a good thing as well, and it's important to bring up those fears and discuss them, before it
Yeah.
happens, especially in people who, are on their first child and they haven't experienced what it's like to be pregnant at all, or like even, go into labor yet.
Yeah.
Which is like a whole other thing, right? And I think that's the most scary part about it for folks. So yeah, I think the way that Ina May, she is an amazing. I read another one of her books, and she's phenomenal at empowering folks who can get pregnant to really, really step into that power and say, like, it's okay.
Yeah.
Like, you can do this. You were literally built for this.
Yeah. Yes. Yeah. And if you have the right tools in front of you, which is what kind of I try to do, is to give you those tools to work with, so you can like handle those fears and those anxieties, because they're fine that they come up, but it's how you handle them that it's going to help your birth experience. So
yeah, exactly.
Yeah.
Great. And also I just wanted to touch on your fertility business as well, because I know that you really like teaching fertility to couples, but also to practitioners. Can you tell us a little bit more about it's Fecunditas, right? Am I saying that right?
Yeah.
Okay.
That's the weirdest word. It actually means the goddess of fertility, and so that's why we chose Fecunditas.
I love it.
Yeah. So in at CCNM, when I was in school, I did the fertility focus shift. Mm-hmm. So that was in clinic, in practice, like a focus shift that's specifically for fertility patients. And then I did an externship, which is where you can leave the school and do a shift outside. So I did it at Two Rivers Health with my mentor, Dr. Sharavati, and she focuses on fertility. And then I should mention that my husband is actually the director of embryology and implantation research at Create Fertility, downtown Toronto. So there was just lots of fertility. Like, I love it, and I'm just surrounded by it. I've been able to attend 2 or 3 different fertility conferences, both Canadian and American, and just learning so much through my husband and my mentor in school that I just became so well versed in it, and I love teaching it to patients. But I had so many colleagues reaching out, being like, "Oh, we know that you love fertility. Can you, like, have you worked with this type of patient before?" Or, "I have these questions." And it kept happening more and more. And then during right in the middle of COVID, my husband and I were like, we should make a course and teach your aspect, because he knows so much about the IVF realm because he's working in an IVF clinic. And I know so much about the naturopathic realm. We're like, let's combine forces and kind of just inform people about, we call it the clinical path. So how to support people both in the medical world and more on like the naturopathic side.
Wow, that's an incredible duo. And I think you guys are doing great, great things so far. So good. And even just to offer that something, like that to practitioners who may not be fully versed in the whole medical side of things, right? But really want to support their patients through pregnancy. And I think that's such a good thing.
I think.
No, sorry, go ahead.
Well, I just think fertility is becoming more and more, people want to optimize their fertility outcomes, or unfortunately infertility is becoming such a more prevalent in our time, because, as women, or like men even, like we're taking longer to want to have kids because, we want to put our careers first, or travel. I mean, not so much anymore, but we aren't just jumping into having babies, so we wait longer, and then sometimes things come up, and it's not taking like 2 to 3 months. It's taking almost a year to conceive. So there's these questions, and then practitioners have a lot of research to do. So we kind of cover those. So there's 6 modules. It covers kind of like the IVF sphere and the differences between these terms, IUI, IVF, like people always ask, like, what does that mean? I don't know what they mean.
Mm-hmm.
And then the other modules are more of how naturopathic medicine or chiropractic medicine or Chinese medicine can help. And then we were lucky enough to get it accredited all throughout North America. So we have it in BC, Ontario, Oregon, and some other states, actually. So
amazing. Wow.
yeah.
Okay. So anyone who's listening, I was just going to mention before before I cut you off there, Courtney, that
Sorry.
Courtney's actually doing a 15% off discount on this course that she offers. So we'll put that in the chat for later for you folks. And that's a good segue, I think, as well, from going from the whole clinical path or the clinical journey of pregnancy into how really naturopathic medicine can help someone who's pregnant. And maybe let's just talk a little bit first about, you know, why naturopathic medicine might be different and what naturopathic medicine can offer someone as compared to, you know, going to see a midwife or going to see their gynecologist.
So, I mean, the gynecologist and midwife are very different from us in the sense that they're going to help you with your birth plan. Like, are you going to have it in the hospital or at home? These are the interventions. They're going to be there with you when you're delivering the baby. Naturopathic medicine is good to help. And I guess I can kind of break it down into like the fertility versus pregnancy. So if you're trying to optimize your chances at conceiving, that's where naturopathic medicine can be really beneficial, because sometimes there's going to be some, lifestyle, nutrition changes, supplement changes. And there's so much information on Google that is just kind of wrong, or some people can become misinformed. Or I've had patients come in being like, I have like 10 supplements, like what one should I be taking? What's the dose? Why am I taking it? And that's where naturopathic medicine can come in and kind of help patients with those goals. So, if it's eating cleaner, if it's living a more active lifestyle, if it's taking the proper supplements that have been shown in the research to like improve egg quality, improve sperm quality, decrease inflammation, because you really want to be your best health before you get pregnant, because I mean, you can kind of change the epigenetics of the egg and the sperm. So I just love that. And that's kind of where I was like, wow, I want to end. Before we had our baby, we were like, we need to be so healthy. I mean, we still indulge. Like, it doesn't mean you have to be strict in this like box, but it's just learning about all the different things that you can do to improve certain things.
Yep, totally. So I just want to stop you there because I realized that we've said a few acronyms that people may or may not know of.
Oh, yeah.
So IVF, let's just go through them. IVF is in vitro fertilization.
Yes.
Right? Okay, so that's more when someone is having issues with getting pregnant. What else am I missing there?
Yeah, so I kind of just quickly walk you through. So fertility, so when people are coming to try to conceive, let's say it's between 6 to 12 months, they'll be referred to a fertility clinic. A fertility doctor will look at their case, do their blood work. A lot of the times now, fertility doctors are working very closely with naturopathic doctors. So even I've built relationships with the different fertility clinics. So you can do an IUI, which is intrauterine insemination, or IVF is in vitro fertilization. So they're kind of different. So in vitro fertilization is more like the last step, whereas IUI, intrauterine insemination, is the middle stage. So depending on what diagnosis you have or what they see, they'll choose one or the other. I mean, I can tell you exactly what they're doing, but if you want me to tell you the exact differences?
Sure, if you want, because I'm sure there's a lot of things that come up for people during pregnancy when they actually don't know what all the options are. And this is just even outside of naturopathic medicine. This is just like, what are the options like for me if I want to get pregnant, basically?
Yeah, I mean, so this is if you want to get pregnant, I always suggest you seek out naturopathic care and work with a naturopathic doctor before seeing a fertility specialist. Fertility specialists are more if they're needs to be more like ultrasounds or like different medical tests that they need to run that can help see what's going on if you're not conceiving after like anywhere from 6 to 12 months, depending on your age. So intrauterine insemination is when they would take like a sperm sample, like a semen sample, and they would bypass the cervix. So they would kind of inject the semen into the uterus so that, and they monitor you. So they see like, oh, you're ovulating. And then that kind of happens. So it's less invasive. Whereas IVF is when they actually take out the eggs. Like, so you ovulate, they kind of like insert a little catheter, suck up the eggs. They take the sperm, and then they take it into a dish, like a petri dish, and they make them connect and fuse and form an embryo, which that later becomes a baby. And then they insert that into the uterus and hope that it kind of like binds the uterine wall so that it can form a baby. So it's very medicalized. So, and it's great because, you know, there's sometimes people, this is the only way they can get pregnant, and it's great. Naturopathic medicine just helps to increase those odds of implantation, and also increases the odds of conceiving naturally before you have to go to that step. Yeah, if totally. That makes sense.
Yeah. So let's reverse a little bit and talk about, you know, how a naturopathic, how living more naturopathically, what that looks like in terms of, you know, say if I'm like in the next 5 years, I'm thinking of having a baby. This is fictional, but in the next, you know, within 5 years, is that like a good enough time to like start getting healthy, or like when's a good time? You know, you mentioned like, okay, say if myself, my partner have been trying for like 6 to 12 months, which is a long time. That's like a full year of just trying to conceive. You know, how early is too early?
Yeah, 5 years is too early. Okay. So ideally it's like 3 to 6 months. You know, sometimes women are like, come to me and they're like, okay, we want to get pregnant next month. And I'm kind of like, okay, like that's a short amount of time.
Okay,
we usually look for like that 3-month window to like change, to help like alter hormones and like optimize health, especially egg quality health. It takes a little bit longer. So we look for 3 months to 6 months, but that doesn't mean like you can start living a healthy lifestyle at any point. And a lot of the things that are healthy lifestyle, so eating a proper diet, you know, moving your body, practicing some sort of meditation, journaling, for like important for your mental health, or getting outside and being like immersed in nature, and then taking the proper supplements. A lot of those things can be done way before. It's just making sure that they're being done right before pregnancy to help your chances.
Got it.
Yeah.
So okay. So the road to expect for someone who is maybe experiencing issues after trying is about 3 to 6 months if they're working with a naturopath. Yeah. And well, ideally 3 to 6 months before you start trying, because then hopefully there's no issue, or there's less option for an issue. Yeah. And when people come and there's already been like that wait time to 6 to 12 months, it's really just working with them to help like change different things in their lifestyle or diet or supplement routine that can help to increase that chance even for the next month. Because again, like you said, 6 to 12 months is a long time. It's hard to tell someone who's been trying for 12 months, like, oh, let's just wait 3 or 4 months to optimize your health. Usually if it's that, we're just like, okay, let's try to figure out what is happening in your body that's preventing this from happening, like the pregnancy, and how can we change it or make it more optimal for those chances to increase. Yeah, got you. Okay, that makes sense. And then, yeah, totally. That's like, yeah, definitely crystal clear. So in terms of, say I want to, you know, see a naturopathic doctor along with my kind of quote unquote like mainstream health care providers. how many visits should one expect to have with a naturopath who really focuses on fertility?
Yeah, I would say that varies depending on the case. So the initial intake is always like the longest. So anywhere from 60 to 75 minutes of just a thorough fertility intakes can even be upwards to 90 minutes. So if patients are working with fertility clinics already, there's lots of blood work to look at and lots of medical, like ultrasound sheets, x-rays, MRI, depending on the case again. So it's usually anywhere from like once a month usually. So after the intake, it really depends. And I can kind of talk about the modalities. So for naturopathic medicine and preconception, even to pregnancy, the most common modalities would be so nutrition, so making sure that people are getting a great amount of fat and protein and not just a lot of refined sugars and carbs, which seems to be like the most common diet, which I mean, that's what we're working with, but we kind of, my job is to kind of inform and give people this like knowledge is power. Like this is the importance of healthy fats and for your hormones and the importance of like a rich protein in your diet and complex carbs and fiber. So we really spend a lot of times talking about nutrition, lifestyle, so decreasing that stress, which unfortunately is the way of the world right now, is lots of stress and cortisol. And then herbs. So I love herbal medicine, working with different herbs depending on the patient. Supplements. So I'd say, and we can kind of dive into supplements more, but supplements, there's like definitely some favorites, and making sure people are on those and taking the therapeutic dose. And then acupuncture has been one of the most studied modalities for helping people with fertility, actually.
Okay, yeah. Interesting. I'm intrigued by that. So there's a few things that you said there. We can definitely talk about supplements more because I think that's what people are asking for, at least in the surveys that I sent out. And then also, yeah, I'm intrigued by acupuncture and how it can help. And yeah, if there's maybe any recommended kind of eating paradigms. I know I don't want to call them diets, and I don't think that like people who are going through infertility issues should also diet. Like I don't know if that's the right approach, or if they're already pregnant, you know. So maybe let's just start there and say, like, I know you mentioned a few things like healthy fats and stuff, but is there any particular kind of eating paradigm that you recommend?
So the most studied eating paradigm would probably be the Mediterranean diet. And yeah, I say diet loosely because, again, like, diet is a funny thing. Like, depending on the case and the person, like some people love diets and they love like eating regimes and plans, and we working with what works for them is important. But Mediterranean is more of like a high fat, moderate protein, and like lower carb diet. And that one has the most research associated with increasing fertility and while pregnant, even like boosting those outcomes.
Okay. And is that probably to do with the fact that it is high fat? Yeah. High fat. And that's really good, right?
Yeah, just healthy fats. People think fat is bad, and I think that's like a misconception now. More and more it's coming out that, you know, like fish and avocado and eggs and the vitamins and minerals that you get from those items are so good and important.
Okay, nice. So the Mediterranean diet. Yeah. Okay. And then maybe tell us a little bit more about acupuncture, because I think this is pretty common in our world, in the sense that, like, yeah, we know that acupuncture does amazing things for fertility, but a lot of people who aren't in our world have no idea what goes on.
Yeah. So acupuncture. So now certain fertility clinics actually will have an acupuncture room where you can go pre and post IUI or IVF transfer to get acupuncture done. So acupuncture works to calm that nervous system, which is in overdrive when anyone's trying to conceive. Like trying to conceive is very stressful for most people, because you're always like, is it positive? Is it negative? The pregnancy test. And then once you become pregnant, there's this stress on the first trimester, this like again, and this is another thing, like the first trimester, don't tell anyone you're pregnant, because what happens if you miscarry, right? Like there's like this, you have to wait till the 12-week mark, which is the second trimester. So acupuncture, I think, really helps with that, calming the nervous system. There's lots of points. So Chinese medicine, using the different meridians in the body to help decrease the sympathetic fight or flight mode. And also it helps increase circulation. So a lot of the points are around the uterus, around the ovaries, so that reproductive area, that help, increase the quality of the eggs, increase the quality of that circulation to the tissues, decrease inflammation, and just like move things. So there's not that like stagnation, that like stuck sensation, if that makes sense. I'm trying to use lingo that's as much
I hear you.
Understandable.
Yeah, and I get it, because of like just the stagnation and those kinds of things are a little bit more traditional Chinese medicine like language, but I think that makes sense for folks who are watching as well, people who are trying to conceive and don't necessarily know why it's not happening. And for one, acupuncture really helps, like you said, bring blood to an area that may otherwise have not have a lot of blood flowing consistently there, right? So I think that's one really good thing. And it also, with blood, brings nutrition and everything else, and takes away a lot of toxicities and other things. So it's basically cleansing that area out, right?
I like to always say it as, like, to simplify it, like I'm sticking like a small needle into the area, like I'm causing an injury essentially. So what happens when you prick your skin? You start to bleed, a bunch of blood comes, like blood is increased to the area, like different cells to help clean up the debris and help heal that area. So if I'm doing that around a reproductive area and more blood is coming to it, that helps with that repair and that cleaning out of anything that might be, preventing that implantation for pregnancy. If that makes more sense.
Yeah, that's
usually people get it more after, they're like, oh yeah, that makes sense.
It's a great way to put it. Yeah, I love that. And of course, for anyone who has questions, honestly, just write them in the comments below, and we can say more about that if you need to, if at any point we said something that doesn't make sense. And let's talk a little bit, Courtney, about fertility supplements and what that looks like. And, do people need to be taking prenatal supplements?
Yes. Yes.
Okay.
I would say, yeah. I mean, prenatal supplements are great. A good quality prenatal is the most important. So a lot of the times, the ones that I see the most commonly are from the drugstore. They have a lot of fillers in them. They don't have the active ingredient that we're looking for. So really, a prenatal has a lot of folic acid. Those are the two terms that you'll hear a lot of. So that's really good for preventing neural tube defects if you were to get pregnant. And that's why a lot of anyone who's trying to conceive is usually suggested to go on a prenatal. It's like a multi plus like a proper dose of that folate.
Got it. Right. And what is the proper dose of folate? Do you want to share that?
Yeah. So it can anywhere be from 1,000 milligrams. There's lots of research depending on if you're, again, we can get into like more specific terms, but if you're bad methylator, so if you don't convert things properly, you'll have to have more folate. And again, I usually try to tell patients who are trying to conceive to be on a professional line of prenatals, because you'll have that active folate versus the folic acid. Does that make sense?
Yeah.
So that the acronym is L5-MTHF. So that compared to folic acid just means that your body doesn't have to convert folic acid to that L5-MTHF.
Oh, got it. So yeah, specifically the professional brands of supplements will actually have that as an ingredient.
Yeah, and so that, I mean, unless you were to do a genetic test that showed that you were a slow methylator and not like a poor methylator, you won't know if you're taking that folic acid. Your body has to process it through 3 or 4 steps before it gets to that active component that your body can absorb and use.
Mm-hmm.
So using that, like the one that's just already available to your, like bioavailable to your body, it's a better choice.
Yeah, got it. Okay, cool. And what would you say are some like professional lines, or is that like,
Yeah,
like are they accessible to people? You know?
Yes, some are, but most of the time, so NFH prenatal sap, NFH is a line that's third-party tested. It's probably my favorite, but you have to get, they're not sold in like drugstores or anything. You have to get a naturopathic doctor or a holistic nutritionist or someone to prescribe it to you.
Mm-hmm.
But there's other ones, and like I can write them down, but like for people, in like future, if they want to know, like New Roots has a great one. There's a couple others I can't even remember, but mainly a lot of them are fine. You're just looking at the ones that Materna, that's the most popular one. There's like a blue and a pink pill. There's like a bunch of fillers, dyes in them. They don't have like great dosing, so trying to stay away from those ones is usually what I strive for.
Yeah, that's fair. That's a really great point also, just because, you know, a lot of people don't know the difference between like a therapeutic dose and, you know, something that just has a little bit of folate in it, you know, so, you know, where is that? It's hard to know where to draw that line, especially if you're not up to date or like in the know on how much folate like a person needs, you know.
Yeah, definitely.
So, and that's, you know, all the more reason to get in touch with a naturopathic doctor who knows more about these things, but also will ask you other things specific to your own life. And if you are, like Courtney said, maybe a slow methylator, they can actually recommend certain specific supplements.
Yeah.
And is there any other supplements, you know, just going on that train? Because a lot of times people these days, you know, they take a multi, they might take omega-3s, you know, some fish oil or whatever. But for the most part, people don't know what to take like prenatally.
Prenatally, I like that.
Prenatally, is that a word?
Prenatally. Yeah, I would say a great prenatal is number one. And then vitamin D seems to be like, if I could put everyone, it's bad, but I think the top three supplements for trying to conceive pregnancy and even postpartum would be vitamin D, fish oil, and a good prenatal. So there's lots of research that shows vitamin D and fish oil, those two, and sometimes you can even get them combined into one. So you can kind of take one supplement and get both of them. It's great for both trying to conceive, so the fertility aspect, optimizing that egg quality, decreasing inflammation, improving circulation, and then also during pregnancy, there's different studies and meta-analyses that show that it decreases preeclampsia, just gestational diabetes, decreases the risk of intervention actually as well, preterm labor. There was like, it's crazy if you look at the list of, and like the amount of studies that have been done that show how great vitamin D and fish oil are. So those ones I love.
Nice. Yep. And then of course, maybe other ones that your naturopath may or may not prescribe. And then is there any sort of herbs that would help someone as well with fertility, or is that kind of more off the table?
There's lots of herbs. It really depends on the case. So I would most of the time suggest that everyone like talks to someone about their case specifically to decide what herbs, because there's some herbs that are good for more of an estrogen dominance, or if they're like a little bit low on their progesterone side, to boost that. So again, like it really varies depending on the case, but herbal teas are great. Ones that are kind of combination of different things that are nutritive. So nettle, chamomile, ginger, even to help support the immune system, but also just support overall health, versus the hormonal ones that would be more tailored to an individual case.
Got it. Yeah, I see that. And maybe even, I just thought of one thing, like red raspberry leaf tea. Is that safe to have during pregnancy?
Yeah. So, I mean, red raspberry is great for third trimester, so it helps prep the uterus for that, for labor, for those contractions. So it's not like people either say, I've heard kind of on, like I've seen on Google, or I've had patients say like, oh, I heard it doesn't work, or like it's just like a false tale that people have like said down many years.
Mm-hmm.
I've also heard that it's unsafe. Most of the research shows that, it's not strong enough to do anything crazy. It doesn't put you into labor. It just helps with toning the uterus and preparing the body for labor.
Got it. Okay, cool. I think that was all the questions I had about supplements and herbs.
Yeah.
Maybe
there's lots of supplements that tailor to each case. So there's a lot of them, probiotics, CoQ10 I hear a lot about, and like NAC, AL, so lots of antioxidants. But again, depending on your case, depending on what's going on, those can be tailored to you specifically.
Right. Yeah.
When you work with someone who prescribes supplements.
Mm-hmm. And someone who knows what actually is happening.
Yeah, or the brand and the dose. Give you. Yeah.
Cool. Courtney, what would you say is the top factor to consider when you're considering, I want to really optimize my fertility and have a great pregnancy? What's like the number one thing that you would recommend to somebody?
That's tough. One thing, I would say nutrition. Like if you really clean up your diet, like I say diet as in like your nutrition plan, like the foods you eat, not like diet as in like a specific eating paradigm. But if you really practice mindful, nutrition plans where you're incorporating those healthy fats, the proper protein, the proper like lots of vegetables and fruit, and you're eating a vast array of all the good foods, and staying away from those greasy processed foods and refined sugars that cause a lot of inflammation in the body. I think if you're just trying to conceive and you don't have anything that would prevent you, that you see at the moment, to have a kind of that would cause infertility, I think nutrition would be one of the biggest things. Because it's controllable. Like everyone eats and everyone can like control what they eat. I know exercise and movement can be hard with time and what feels right for different people and what they're comfortable with. But I think eating different foods that are like that fuel the body and the mind and make you feel good would probably be the basis and like top thing to start with.
Nice.
Before anything else. Yeah.
Nice. That's good. So I'm going to ask now if anybody in the audience has any questions. Go ahead and please write some questions down about pregnancy. I would love to hear more. And I know I have a few more just from people who couldn't make it here tonight live that wanted to ask a few questions. And while we're doing that, while we're allowing folks to think about some questions, Courtney, I have one final question for you, and that is, what keeps you inspired?
What keeps me inspired? I think just like helping people, really, just like breaking those barriers for people and like helping them break them and realize like, and seeing that big change where it's like, oh, like my sleep is better, or I'm noticing ovulation, like, which we didn't even touch into, but that's a whole other thing. But, or, my periods are regular now, whereas they weren't before. Like those things inspire me to continue to help people and to like have this information accessible and to show people that they can learn all these things and control their health. Yeah.
Nice.
And create healthy little babies.
Yeah, to create all the healthy people.
Yes.
That's really nice to hear. And also, yeah, you did say ovulation, and I'm not sure that everyone knows what ovulation is. Maybe just say like a sentence on like why it's important to ovulate for pregnancy and etc.
Yeah, so ovulation is mid-cycle usually. Textbook says day 14, but really it can be any day in between. when you have your first period to the next period kind of thing. So it's usually mid-cycle, and it's when there's a slight temperature change, the egg is released, and you would notice a difference in cervical mucus, cervical position. Sometimes mood's impacted. Sometimes there's a little bit of like a little bit of sharpshooting pain on one side, because that like pop can be a little bit painful, but that's letting you know that your body's ready to conceive, and like that would be the optimal time to try to conceive.
Yeah, so there's usually like an actual day or a couple days around that day where you're ovulating, and that's I guess the most fertile that you can be. Got it.
The fertile window. So yeah.
Okay, great. So I'm gonna go ahead now with a few questions, but I wanted you to just say a little bit about your 15% off fertility course for anybody who's listening right now.
Oh yeah. And I'll give you the code to release for people. But yeah, so there's gonna be 15% off until we're kind of running it as a Black Friday, Cyber Monday deal. So it'll be from now until Monday night, and then it would give you 15% off. The course is online. It's like you have it forever. So retail price is $3.99 for practitioners. It's accredited in, again, Ontario and BC and other provinces. And so it gets you some credits and a certificate that kind of gives you the title fertility strategist. It covers fertility, again, the clinical path, and it covers that first trimester and how you can support patients in that first trimester. So supplements, acupuncture points, nutrition, and other things like that.
Yeah. Amazing. So I just put that there in the comments section. 15% off, and then Courtney, you will give me that code, and I can send it out to folks through my email list.
Yeah, it's BFCM15.
Okay, BFCM.
Yeah, Black Friday, Cyber Monday, 15.
Got it. Yeah. Got it. I just wanted to make sure I got that acronym correct.
No.
Great. Okay. And then you also offer, Courtney, just to like let people know as well, you offer a free meet and greet at your clinic, right? So that's Two Rivers Health in Guelph, Ontario. Are you doing anything virtually right now? Is it still face-to-face?
I would say mainly virtual, but there is face-to-face, especially for acupuncture. So the clinic works with patients kind of all over Ontario. Because we definitely do have a fertility focus. So yeah. So 15 minutes free meet and greet, and that would be virtual.
Yeah, that's a perfect opportunity for Ontario residents, at least to get a hold of Courtney and chat more about, if she's the right practitioner for you when it comes to your own pregnancy journey. That's great. So let me just get out my phone here because a friend of mine had texted and couldn't make it today. So she actually had a couple questions on. Yes. Okay, nice. So I like this question. She said, can you talk a little bit more about morning sickness and how to deal with that? I lost probably 8 pounds at the beginning of my pregnancy from throwing up so much.
Oh, wow. Yeah, morning sickness is probably the worst first trimester pregnancy complaint. So naturopathically, there's some modalities. Initially, it would be like nutrition wise, trying to get in as much like any food. There's no restrictions when it's the first trimester. It's like get whatever you can get in your body if you have that nausea and morning sickness, if you're vomiting. A lot of NDs offer IV therapy, which is safe in the first trimester. Like different, like lots of vitamin C's and B complex to help, like if you are throwing up nonstop. But I'd say like my favorites would be like a ginger supplements, ginger chews, ginger tea with lemon, like lots of nutritive teas. someone can stomach that. And then also just like smoothies. A lot of times the morning sickness, they can't even get the prenatal down. So mixing like opening up the prenatal, like mixing it in the smoothie, or like spreading it with like nut butter, because then it just like hides the flavor on like a piece of toast, anything to get in those calories, really, because you're just trying to like increase your calories to feed, your growing body. And then I'd say acupuncture has also been shown to kind of help with morning sickness as well.
Okay, that's really good to know for morning sickness specifically.
Yeah, the combination of the three tends to work the best.
Yeah, for sure. And then, okay, that's good enough. And then I also had another question, Courtney. So this person was wondering about medications and pregnancy and even into breastfeeding. What is safe in terms of the little things like over-the-counter stuff, like if you get a cold when you're breastfeeding, or if you have back pain, after pregnancy or during, what is safe for someone to take during that kind of course of action?
Yeah, good question. So with pregnancy, it's a little bit more complicated versus breastfeeding. So for pregnancy, again, I always strive to like help people with herbs or supplements. So depending on the pain, like if it's like low back pain, acupuncture has been great. Those belts, the pregnancy belts, to like take the pressure off the low back.
Okay.
Like referrals, like we use a lot of like referral-based programs. So osteopathy, chiropractic to help, massage therapy with the back pain specifically. If it's like a heartburn, again, I always find that there's some sort of natural supplement or herb that can help that I try to use first. But yeah, there's not a lot you can take in pregnancy. They usually suggest Tylenol, but now more and more there's studies saying that like you can't take Tylenol every day when you're pregnant. So just working with that individual patient to see like what they can manage depending on what's going on. Breastfeeding is a little bit easier, but again, you have to like watch out for certain doses. And if you're exclusively breastfeeding or if you're mixing with formula, like depending on that, or taking the medication away from breastfeeding, like in between your feeds, if that makes sense.
Yeah.
Or pumping. So it really depends on the medication. So that's something we always go through with patients, like what medications are you on, or what questions you have about certain medications that you're on, so that you know what is safe and what's not safe, because there's so many things out there.
Yeah, and you have to do like your due diligence too, right? Because you're not only affecting yourself, you're affecting someone else. And it's so funny when someone is pregnant, that makes such a big deal, right? Because they're affecting someone else.
Yeah, and that's why,
when you make the decision to order yourself McDonald's and it's just affecting you, and you can probably handle it, and you rationalize,
Yeah, I mean, like, yeah, exactly. Your health impacts like your baby's health. Like that is the way. So, I would say like a lot. And again, this is what comes with the vitamin D. Like they're finding that more and more vitamin D intake during pregnancy and even through breastfeeding has decreased the risk. And vitamin D for infants has decreased the risk of childhood asthma and childhood like allergies, which is super interesting. So continuing to look forward to that research that up and comes and shows how taking certain supplements can definitely be beneficial.
Wow, that is amazing, Courtney. Courtney Russell, everyone, thank you so much for being here and for giving us your lovely little discount on your course. For any practitioner who's out there that is interested in working more with Courtney and learning from her that way, you can get 15% off that course through her Fecunditas for Fertility. And then, check Courtney out at Two Rivers Health in Guelph, Ontario. And thank you again, Courtney, for having us, feature you. And I think it's been such a helpful conversation for folks. I tried to put myself in the shoes of someone who was pregnant as much as I could to really think more about those things. And of course, if folks have more questions, you can totally reach out to me through Instagram. It's reawaken_co, just CO, or at the Erin Edwards. And we host inspiring insights like this every Wednesday night at 6 p.m. So looking forward to hearing more people and getting more in tune with folks and providing opportunities for learning and for sharing and for a better, healthy world in the future. Thanks again, Courtney.